Welcome. I'm Dr. Susan Blank, President of the Georgia Society of Addiction Medicine and Chief Medical Officer for BioConfirm Laboratories. With me today is Tom Connell, Director of Behavioral Health. Together, we developed MyHealthBridge, one of the components of the BioScript medication management protocol. Let's review the components of BioScript model. First, we have BioInform. This is a web-based assessment to help you assess whether or not your patient may present a risk of developing an addiction to prescription medications. This documentation is then available for your patient's medical record and can help provide medical necessity criteria for the use of the urine toxicology screens and testing that you may do on this patient. Number 2 is personalized medical assessment. As we know, many patients may present significant side effects to certain medications, while other patients may have a very poor result. This may indicate the need for biogenomic testing to determine your patient's unique metabolic profile. This information can help guide you and your patient to making a proper choice in which medications they might better tolerate and with which they might have more success. Number 3 is the toxicology laboratories. Certainly, BioConfirm Laboratories presents you with state-of-the-art urine toxicology, screening, and drug testing. This helps you confirm whether or not your patient has been taking their medications as prescribed and is being in compliance with your treatment plan. Number 4 is the Confirm It app. This is the physician portal allowing you to review your patient's most recent test results, their risk assessment, and their genomic testing. Background information to help you understand some of the more complex issues related to the urine drug testing. And finally, number 5, MyHealthBridge. This, I think, is the most unique and possibly the most helpful component of the BioScript medication monitoring protocol. In order to help understand how MyHealthBridge might be useful to you, I'd like to introduce you to Betty Jones. She's a 54-year-old female who's been in your practice for about 5 years. She's a pleasant lady, and you always enjoy your interactions with her. You are smiling as you walk down the hall because you realize she's the last patient of the morning, and indeed you're going to be able to make it to your lunch with your significant other. Your smile starts to fade, however, as you flip through the chart and look at the results of the last toxicology screening and testing that was done on Mrs. Jones. Fortunately, she is consistent for the oxycodone that you have been prescribing for her, but you also notice that she is inconsistent and positive for a benzodiazepine as well as hydrocodone and its metabolite hydromorphone. You are not sure what's going on, but you're having a variety of feelings: confusion, frustration, maybe even a little anger. Your smile fades further, and you know 2 things for sure. Number 1, you're probably not going to make your lunch, and number 2, you have no idea what to do and what to say to Betty. So what is your next step? What do you do for your patient now that she has an inconsistent medication monitoring result? We hope your answer will be MyHealthBridge.
Thanks, Dr. Blank. So you may be wondering, what exactly is MyHealthBridge? Well, it's a patient engagement system designed to provide patient education, lifestyle management strategies, and identification of support resources. And it's really offering a vital resource to the physician of clinical value by offering care coordination and support of the doctor and patient relationship. So the referral process for Betty is really quick and simple. Just go to the physician portal and click View Results, and the screen before you will appear. And all you have to do on the right-hand column is click Refer Patient. And the process is quick and simple.
When the lifestyle coach begins the interaction with your patient, they may review the inconsistent drug results and explore some factors that may be contributing to these results. In the case of Betty, they were able to determine that a few days prior to her drug testing, she had visited her dentist's office for a procedure. During that procedure, she was given a local anesthetic and some medication to help her relax. She was also given a prescription for hydrocodone to help with the post-procedure pain. This explains the unexpected inconsistent results. The lifestyle coach will document this for you, and this will again be part of the report that you can add to the patient record, explaining the action and the interaction, as well as document your action in regards to these inconsistent results. During this interaction with the lifestyle coach, they will be reminding the patient to take their medications as directed, to get their refills on time, and to follow your medication contract and treatment plan. During the lifestyle coach's interaction with your patient, they will also spend time going over all of the prescribed medication, whether by you or other healthcare providers. They will document any over-the-counter medications being used, vitamins, supplements, and herbal preparations that may be contributing to the inconsistent results. This information again will be documented and be part of the report sent back to you for the patient's chart. They will spend some time educating the patient about the potential of dependence and possible abuse of medication, as well as the proper storage and disposal of medications. This is our hope that it will help eliminate or minimize the possibility of diversion of these medications. Again, the lifestyle coach will be reinforcing proper behaviors regarding medication, dosing, scheduling, not taking alcohol or other illicit substances, and to take the medications as properly prescribed, not to chew or crush medications.
So our patient education will not only include some of the elements that Dr. Blank has just outlined, we're also going to be helping to increase the patient's awareness of their risk level. If you reflect back on the BioScript model, the patient is going to be assessing their level of risk, and this risk is the propensity for the patient to develop a dependence. So we want to raise their awareness so that we can reduce this potential risk. We're also going to be discussing with the patient about lifestyle and stress management strategies, and we're going to be encouraging them to set goals to make changes to improve their health and well-being. We're also going to be explaining the whole continuum of abuse, dependence, and addiction, while also identifying resources of support through online and within their local community, and when necessary, treatment options. So one of the most unique components of MyHealthBridge is the care coordination component. We're going to be sending you a summary report to outline all of the information reviewed with the patient following engagement with the lifestyle coach. The report provides you with the documentation you need for the medical record regarding your interventions. We want to encourage a collaborative relationship between the patient and you, the doctor, to improve their health and well-being. So let's talk a little bit about the MyHealthBridge report. We've mentioned that it's going to provide you with documentation regarding your interventions for the patient for the medical record, and that it's going to support your medical necessity. We also believe that it'll help reduce some of your liability exposure, and it provides an opportunity to reinforce some of the patient-determined goals for self-improvement. We also believe that this will help to improve some of the patient practice retention when patients are inconsistent, giving them an opportunity to respond to your interventions. We're also going to be making this report easily accessible via fax or through the physician portal, which can then be imported into your EMR. So let's quickly dissect some of the components of the MyHealthBridge report. First of all, the patient's risk level is going to be easily identified on the report. The summary comments will also be available on the report regarding the engagement with the lifestyle coach. You'll also see a section on the report that identifies the different components of a content area that we review with the patient. And finally, there'll be comments available regarding that specific content area covered. Now that we've reviewed some of the value to the MyHealthBridge report, let's talk about some quick facts. First of all, we can offer some engagement to the patient through either a patient portal, available 24 hours a day, or they can schedule a time to meet with one of our master's level lifestyle coaches. We offer flexibility in appointment scheduling, open Monday through Friday from 12:30 until 8 p.m. We offer a bridge to counseling options when your patient is in need of additional care. We're available to you as the doctor for patient reviews and consultation following an engagement. You as the doctor can order an engagement, whether it be in full or in segmented protocol. And again, you're going to receive a copy of the MyHealthBridge report that's going to outline all of the components of the patient engagement to close the care coordination loop.
We now return to your appointment with Betty, and we're happy to see that the smile has returned to your face because you have access to MyHealthBridge and the BioScript medication management protocol.